Hi, my name is Laura Mears and I'm a clinical administrator with the Blank School Nurses. I also work with our Grandview Student Health and also our advocacy and outreach team. We are teams that work out into the community through Blank Children's Hospital.
My name is Allison Line. I'm a school nurse employed by Blank Children's Hospital, and I work at Hillside Elementary in West Des Moines.
So this year with COVID, just like at the hospital, our community health teams have really taken on a big challenge. The support that we have though through the health system and having a partnership with Blank along with the West Des Moines Community Schools has really made it so that our nurses could succeed and allow us to support our families within our community. This year, we will be honest that it has been a struggle. Many of our nurses have said that it is probably one of the hardest years in their career alone. We have one nurse in every building and you're the only individual that knows most of the information about health, and a lot of people really rely on you. But that is something that really is also, it allows you to feel accomplished, it allows you to want to continue to help all of the students, families, and staff in the West Des Moines schools along with our Blank Children's Hospital.
I have to say that our staff has been awesome at adapting to these changes as well. They've not only had to teach face-to-face, but also teach online at times. We rely on them for help in contact tracing and communication with families regarding children who are ill or families who may have been exposed to COVID. So it's been great to have that extra collaboration this year as well.
We have, as school nurses, have really become contact tracers, along with building the partnerships with our Polk County Health Department, who have truly been amazing. But this is definitely a positive of some of the things with our pandemic, is that we have built and continued to strengthen partnerships, not only with our county health department, but our physicians and providers at Blank, along with other school nurses across our central Iowa community. We, with this contact tracing, will I be honest that we have had some struggles? Yes, absolutely. To call a family and to tell them that their child has been exposed at school is truly heartbreaking, and you just experience the pure raw emotion from many of these families. It can be just that they're stressed, they're sad, they're angry, they're fearful. But the thing that we have found is that we can support them. Many times we're the first person that talks to these families after they find out they're positive from a text message and a quick rapid test. And so that's one thing that has been, that we have found that we can really do, is to help support those families, is just listening to what they have and answering any questions that they have and providing that education to them throughout the community.
So we've been able to successfully keep kids in school face-to-face for the majority of the year, and I have to say that kids have done amazing adapting to wearing masks all day long. For their mental health, it's been so good for them to be back in school and face-to-face with their peers and their teachers. We really need the community to keep helping us keep the kids in school. Staying home when you're sick is huge. Not sending your kids to school when they're sick is huge. That can really help us mitigate the spread of COVID throughout the school. Community activities, sports, extracurriculars are very, very important. We realize that that is crucial to everyone's mental health. But again, staying home when you're sick really helps keep kids in those activities as well, so we can keep that from spreading.
Our team in the schools definitely needs our community to know that it is not over yet. The fight is not over. It's been long. We know everybody is fatigued, and we call it COVID fatigue, but we just need you to know that we need you in order to allow us to keep our kids in school and keep our community open. Right now, you know, it's a very exciting time to have the vaccine available. Many of our school nurses are on their first and second dose. It is a safe thing. We encourage it. We're trying to provide education to our staff and make sure that they understand and have all of the information. But we know that we still need all of our families, students, staff, and our whole community to continue to social distance, to continue to follow all the mitigation strategies, and to wear their mask all of the time so that we can keep all of our kids in school.